Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. On today's episode, we're excited to welcome Dr. Margaret Gaglione, a physician in internal and bariatric medicine at TPMG Coastal Internal Medicine and Tidewater Bariatrics. Dr. Gaglione specializes in treatment of obesity, diabetes, and hypertension. Thank you for joining us.
Oh, it's so nice to be here. Thanks for the offer.
To start, could you provide us with an overview of the recent trends in obesity rates, both generally and specifically within your practice?
Obesity is the illness that's really increasing the most in our population, particularly here in Hampton Roads. We divide obesity into class 1, 2, and 3. And so individuals that have a BMI or a body mass index that's greater than 40 are considered morbidly obese or class 3 obesity. And that's actually the class that's growing the fastest, particularly with women and particularly with younger populations. So really addressing obesity as a medical problem is so important to make sure that we maintain the health of our patients. In my practice, I've been a bariatrician for close to 20 years. I've been in practice for 32 years. But what we really do is we work with patients that want some help and direction in managing their weight. We have a very robust practice. I also see patients for internal medicine issues as well. But the first thing when I'm working with a patient is really to find out where they're at, because all obesity isn't just one thing. We have to figure out why they've gotten to where they are, and how I can help them in really beginning to change their habits, which will help us work on working a plan for managing their obesity. So the first thing I often do is really start with the patient and ask them, what's your outcome? What do you want? Do you want to walk better? Do you want to feel better? Is it better management of your other medical problems? And so really setting the stage as to what the outcome is, because if we think about anything that we do well, if we have an outcome in mind, we can get there. Right? If it's, sometimes patients will say, I want just to feel better. So then I'll try and drill it down to be a very much more specific kind of outcome that they want. And then the other thing is really, what is their current situation? What is their life like? How do they get their food? Who prepares their food? Are they preparing it for themselves? I'll also dive into what's their home environment like, what's their job like. Often I find that for individuals that can maintain their body weight, they don't realize that it's a skill, right? And so skills take time and practice. And so often if I find out that the person is very successful in other areas of their life, I can use those same skills that they have honed to develop their profession or their expertise in art or their expertise as a parent and say, you've got skills, we've just got to apply them to this area. It's hard. And, changing habits is really, really hard. But, eating is a behavior. And quality behaviors have boundaries. And it's beginning to look at that and realizing that to maintain one's weight, it's a skill. And how we do that and how we work with that is really important. I know you and I are going to get into talking about medications in a second, but really obesity is a behavioral and a physiologic disease. And so we can work on the physiology of obesity, but we have to work on the behavior as well. Otherwise, we are lost in a vacuum, because we can make over 100 food decisions a day. And if we don't have somebody that's there to help us, guide us, or teach us, because oftentimes when obesity runs in families, right? And so we end up with disordered thinking regarding food that's generational. It's not just starting with my patient right here.
I know someone who went through gastric bypass surgery, but they didn't change their lifestyle afterwards, so they remained overweight.
Right. And so bariatric surgery is an excellent tool, but it's not insufficient if we haven't changed behaviors. And so we really need to look and say, is this a tool? It's no different than really using medications, right? I mean, it's more effective and able to quiet food noise faster. But one has to continue to work on that, just as you would continue to work on any behavioral skill. One of the things that we fail to recognize often as physicians is how poor food leads to a lot of food noise in one's head. And I think the use of these new medicines like the GLP-1s and the GLP-1s and the GIPs really have brought to the forefront is that poor food leads to poor thinking regarding food. And it's brain, I often talk about it as food noise, or, the food is talking, or it's just people are always thinking about it. And these medications often decrease that food noise. But also eating well decreases that food noise, but it takes time and planning to do it. And so we talk about boundaries, really simple things that people can start doing is really becoming aware of when they eat and where they eat. So one of the first rules I say to people is you got to eat at the table. No eating on the couch, no electronics, no working on your computer and eating. Really old school. You can sit down with a person or by yourself, but you get a book or a newspaper, no electronics, so that you really are enjoying your meal and knowing that you're eating. Because when we watch TV and we eat, we're using food as entertainment, okay? And that's not what really food is for. You and I could sit down and have a meal, Rachel, and I'm going to enjoy your company while I'm eating. But if my relationship is with my plate, then it's not with you and I. And that's the important thing of really working to make sure that people are aware they're eating and enjoy it.
Absolutely.
And so if I'm sitting down and eating during a 3-hour football game, well, that's a lot of calories I'm taking in. And I'm not even mindful that I'm doing it, right? So eating at the table is the number one thing. Really trying to get people to have periods of time when they're not eating. So trying to get people to say, I'm going to have a lunch and a dinner, or maybe a breakfast, lunch, and dinner, and really decrease the intermeal eating. Because often that's not done because somebody's hungry. We often do intermeal eating because we're anxious, or we're trying to stay awake, or we're bored. And so that's not a good use of food, right? Food is for nutrition, right? If we keep taking in calories, we're going to continue to grow. We don't need all those calories. So there's other things called intermittent fasting, which is a great buzzword. I love it, okay? And part of the great thing about intermittent fasting is that you pick a period of time, and that's the only period of time you're going to eat. And when that first came out a couple of, maybe 5-10 years ago and got into the lay literature, it made me crack up because my mother was the inventor of intermittent fasting. I mean, the kitchen was closed after dinner. We didn't eat in between meals. It was just done. And so, that's sort of what was normative in my house growing up. That's not normative in a lot of people, and so in a lot of people's homes. And so we have to work on that and building on that skill, okay? Because these are skills that are teachable.
And as the landscape of weight loss medications evolve, many patients find it challenging to navigate their options. Could you provide an overview of the latest classes of weight loss medications and how they differ from some other options?
Sure. So I often use medications, and it depends on where the patient needs the most help. So we have longstanding medicines that can decrease appetite. Some of them are actually stimulants. And in the right patient population, they're wonderful drugs. So it's a matter of figuring out what it is. If somebody is eating because they're depressed or anxious, well, maybe we should use some medications to treat the underlying disorder because they're self-medicating with food, right? But if we can use pharmacology to choose the appropriate drug, then maybe we can mitigate the self-feeding, okay? The newer drugs that have gotten, a lot of big play because of their effectiveness are called the GLP-1s or the GLP-GIP agents. And these drugs are drugs that are providing a synthetic form of a protein that we all have. And so these proteins are active in our bodies, but these medications make the proteins more prominent and last longer. And so the GLP-1s, the ones that you've heard, Wegovy, Ozempic, Trulicity, all of them work on receptors that we find in the brain, in the pancreas, in the stomach. And the nice thing about that is that these medicines often decrease food noise. And so people will often say to me, I feel normal for the first time. And so like the GLP-1s in particular, they decrease appetite and they increase the sense of fullness. Often when patients develop diabetes, they have rapid emptying of their gut. So their stomach empties fast. And if somebody's eating simple carbohydrates, that increases the rapidity of which the stomach empties that food, right? So people feel hungry again. So these medicines slow gastric emptying down. They make people feel fuller. They regulate the appropriate release of insulin. And so they also, particularly the GLP-1s, have been shown now to decrease heart attacks and decrease non-fatal strokes and MIs. So even in patients that do not have diabetes. And so that's why several of them have been approved for obesity management alone and not obesity and diabetes. The biggest thing is that these medicines are really expensive. And so depending on patients' insurances, that's the biggest hurdle that we're working with now. But I think overall is that I had tremendous success with my patients long before we had these medications. So I think the important thing is really, patients not giving up and saying, okay, I don't have access to this medicine, or I have to show that I have to be in a program for 6 months before my insurance company will help. Those are all good things, okay? But it's working towards that and trying to see where we are and, working on trying to change the behaviors as well as the additional support from medication. And that's what these things are, is additional support, much like we talked about gastric bypass being a tool, right? It's a phenomenal tool. These medicines are phenomenal tools.
And they're a very hot topic. I know Ozempic was everywhere recently. And from your perspective, advancements in technology and medicine are great and coming along. But we also need to keep in mind the important things of
behavior and knowing what people are eating. The biggest thing is that often patients think that they can be successful without planning, okay? I use a lot of analogies when I'm talking with patients because they stick, right? And so I often say to them is, remember when you used to take care of kids, whether it was a niece or a nephew or your own children? What's the number one thing you did when you left the house in the morning is you took the diaper bag. You didn't say, I'll run to Walgreens when they get a blowout. But that's what we do. We don't plan our meals. So the most important, and I've said most important because they're all important, but one of the most important skills is making sure that you food prep. Plan your meals. Plan what you're going to have, breakfast, lunch, and dinner. You and I wouldn't go to work without our phone. I wouldn't go to work without my glasses. I couldn't even get out the front door, okay? And so because I get in the habit of doing that, I never leave without my glasses. I don't leave without my phone. And I never go to work without my lunch, okay? And so making sure that I have sufficient tools to be successful. And that's really what we work with. My nurse practitioner, Erin Briscoe, is phenomenal also, and she works with me as a team. But we work on making sure that we develop and we teach the skills to be successful. And we may use medications along the way, but the really important thing is teaching the skills.
There's been considerable discussion around new classes of weight loss medications. Does TPMG offer these for weight loss, and what should patients know about their benefits and potential side effects?
So, yes, I mean, it depends. Certainly, there's a lot of us that prescribe the medications, not just those of us that are bariatricians. But primary care, some of the cardiologists are prescribing them now because of the notable improvements with heart disease and decrease in heart attacks and non-fatal MIs and strokes. But a lot of it comes down to what is the patient's copay with these medications and things like that. The medications are well tolerated generally. Because the side effects of slowing gastric emptying, sometimes patients can feel constipation. They may, because of maybe if they've had a habit of overeating, there's such a disconnect initially, like, oh my goodness, I can't overeat with these medicines. So that's an important thing. The other thing is that these medications really need to be stopped multiple weeks before surgery. Because we have found that, because of the delayed gastric emptying, they could increase the risk of aspiration during surgery. So that's new guidance based on that. But these medications are very effective in really decreasing the noise so that we can begin to build the skills.
Before we conclude, Dr. Gaglione, do you have any final advice on successfully incorporating weight loss strategies and patients' overall health routine? You've covered so much and answered actually questions that I haven't even asked yet because you've just been so ahead of the game. What final advice do you have?
I think that recognizing that quick fixes don't work. We've got to really work on long-term improving health. And if people think that, that's their goal, they want to improve their health, it's not a number on the scale. It's, can I walk better? Are my sugars better controlled? Do I have more energy? Am I sleeping better? All of those things matter. Then we can start and we can help coach them along the way of doing this. It's hard. It is incredibly hard. But one of the things I often say to my patients is choose your heart, right? Because being unwell is hard too. And so if really building new skills and working on it and creating an environment of success, that is hard. It takes hard work, okay? But it's doable. And it's something that people will always have to work on.
Choose your heart. I think that should be on a sticker.
That's my motto, choose your heart. Because everything is hard, right? But people often feel empowered. And I think that's the most important thing, is that you can improve your health. No matter whether you're 80 years old or, 20 years old, you have the power. And our food is our number one medicine. What we take in and put in our bodies is so incredibly important. And if we put junk in, we're going to feel like junk. If we put good food in, we will feel better. And that's the number one thing that we emphasize at Coastal Internal Medicine and Tidewater Bariatrics. It's been a pleasure speaking with you.
Oh my gosh, I've just been so honored that you were here. How can listeners get in touch with you for personalized care or more information?
Certainly they can look at the TPMG website and they can find us all there. We're located on Kempsville Road in Chesapeake. So we have an easy access and a wonderful staff.
Well, thank you again. And thank you to our audience for tuning in to TPMG Health Talk. For more information or to ask any questions, visit mytpmg.com. Stay tuned for our next episode and take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.